No need for an introduction. We know that Ron is a distinguished professor and the dean of the UCLA Fielding School of Public Health, and Ellen is our dean here at the Johns Hopkins Bloomberg School of Public Health. And so one question that now is a higher level, because it's a school level, is how do you see schools of public health changing, and how do you see their departments of biostatistics needing to evolve in the future?
I'm just thankful you didn't carry over that last question to our next question. But it is something, it is top of mind, and Liz is right. You know, we spent a lot of times in our chair meetings talking about this. In fact, our previous provost, who left to become president of Tufts, on his last day with us, he said, you know, I really love you guys. You're a great school, etc. He took a minute talking about that, and then he immediately said, but you guys have to figure this out. You have an existential threat. You know, your reliance on soft money, you're just not going to survive if you don't fix it. And we're all kind of, you know, we had these glasses of champagne. And then he just like put the kibosh on that. And we asked, we said, well, what do we do? What are your thoughts? And he said, I don't know, but you got to fix it. It's something we think a lot about. So now I forget that. So how things are changing. So obviously, AI is top of mind. I mean, that's changing everything we do. I don't want to spend a lot of time talking about AI. Maybe you will, but it's clearly something that's changing health. It's changing public health. It's changing the School of Public Health. And it's definitely changing biostat. And as I think Scott mentioned, the university is putting a lot of resources into data science and AI. Interestingly, most of those resources are centered in the School of Engineering and in the Department of Computer Science. But I think it's something that, again, one of those topics we talk a lot about these days is how does biostatistics, what role does biostatistics play in all of that? And we can talk more about that. But I want to put that aside because that's the obvious thing that's going on in public health. But in thinking of my answer to that question, I thought of 4 areas, really, that I think changes in public health that have implications for biostatistics and for schools of public health. One is a growing emphasis on interdisciplinary collaboration. You can't, I mean, our issues these days are way too complex for just, you know, going off on your own and thinking about solutions. They definitely require bringing disciplines together. I think this is something that Chuck did very, very well. He worked very well with other disciplines, and I think the department has done an incredible job, but I think we have to continue to build those collaborations. I think it also begs the question that has been raised, at least in my tenure here, as to whether or not biostatisticians should be placed with in other departments with the people who are doing applied work or the work, or do you concentrate the biostatisticians in a department? I think it's clearly both, but I think we're going to see a little bit of a change in that regard, and we're going to have biostatisticians permeated throughout the different departments. So that's one area. The second is a shift towards more a pragmatic approach to research, a focus on real-world data, analyzing real-world evidence, and in particular electronic health records, wearables, you know, other health databases. There's no way around that, and it's something that we should embrace. It obviously ties into the growing emphasis on data science and AI for sure. The third is just a growing emphasis, or I mean, it's there. We were talking about this yesterday. The increasing something that in our research we have to take into account more and more, and in our teaching. And I think it dovetails into an emphasis on diversity, inclusion, equity. Again, the department has done some great work. I think of Michael Rosenblum and Jeff Leake focusing on the community and getting into the community and working with the community. I think we're gonna, the field of statistics has to do a better, I think it has to do a better job of bringing those, that context into the work that we're doing. I don't know if it's social statistics that we're talking about, but statisticians who care about thinking about those social determinants, it's not as, if you look at all our biostatisticians, there are not as many who are focused on those social determinants. And then finally, the obvious one is the changing face of education and emphasis on online education, hybrid education, and also educating the public health workforce. And there's a growing interest in public health and public health practice. And biostatistics has to play an incredibly important role in bolstering that kind of education. So I'm going to stop there, and I'll turn it over to him.
Well, thanks, and Marie, thanks for organizing this session. And let me add a little bit on to what Ellen was saying. First, I think it's useful to reflect where the state of public health was when Chuck first came here, which was 60 years ago this year. He got here in 1964. And at that time, smoggy days were the rule in most big cities. The EPA did not exist. Medicaid and Medicare didn't exist. 40% of Americans were smokers. In 1964, most people thought that we had seen the worst with infectious diseases, but COVID and HIV/AIDS was still to come. So the state of public health has changed. Where we are today, some problems are still there. I mean, pandemic preparedness, thinking about infectious diseases and being prepared for the next one, clearly a priority. Ellen mentioned social determinants of health. You think about health equity, you can take two zip codes that are in most major cities that are 10 miles apart, you have a 10-year difference in life expectancy, understanding why you have that. Communication. We've seen with the pandemic the mistrust in science, that a lot of science actually is not reproducible. Misinformation, not talking straight about what the data says. And I think we as a community of statisticians have a lot to contribute in plain talk. And I think that was something that Chuck, really, he spoke plain, right? He told you the way it was, and I think there's a lot to learn from that. And the other area, of course, that we've talked about is just the incredible explosion in data science, in data technology, with data coming from all over. I mean, all formats of data, whether it's imaging, text, and an incredible speed. And how we deal with that technology is, I don't think we can underestimate the impact of AI. I've seen some studies that showed people getting medical counseling from AI or an actual physician, and they're more, the empathy was getting higher ratings on empathy from AI than they were from physicians. Studies that have shown on math education that if you have an AI tutor, it's actually effective. And So I think it really is going to change our lives fundamentally. What would Chuck say about all of this? He would probably be a little bit of a curmudgeon at first, but I think he'd say, yeah, we have to evolve, we have to change. And I think he would embrace all of this.
And so maybe as a follow-up to that, so Ellen, you brought up about the work that has been previously done with Michael Rosenblum, Jeff Leake, going into the community, working with the community, training community members, to work with data. Are there other things the two of you feel that departments of biostatistics need to expand more into in order to go with these, changing and important problems?
Well, one very practical thing is in teaching and coursework, integrate examples of or use health equity as a basis for teaching statistical principles and statistical methods. That's one thing that I can point to in the teaching.
What about communicating with the public?
There's no question. I mean, communication, I agree that that's one of the most important things for public health right now, and I think statisticians have an outsized responsibility in that regard, because it's often the job of the statistician to explain the evidence and how we got the evidence and why this is true, and this is untrue, or this is supported by the evidence, this is not supported by the evidence, and explaining those relationships is difficult. And I think some statisticians, like Chuck Rohde, did a really great job of talking about statistics in a way that the general public could understand. But I think we have to do a better job of that for sure.
So I was thinking about what Chuck, what direction he would suggest. And I don't think he'd be very prescriptive at the end of the day. And I was thinking about, where he would take things. And I have 4 C's for Chuck. And actually, the first C I had was communication. That he would say that's really important, and particularly with what we're seeing with technology and how that can confuse people, and I think that's going to be very important. So that was the first C. The second C is collaboration. We have extraordinary public health practitioners and scientists here, right at Hopkins, and of course in other universities, but he would say, work with the best. Reach out, make connections, and by doing that, you will work on important problems. Find people you want to work with, that's important, who are fun to work with. Fun is very important, but also work with people who are really talented, and that's going to keep you relevant. So that was the second C. The third C is for compass. Chuck always talked about models and staying close to principles. And I think we need a compass as we navigate just what's going on with all of this explosion in data science and with artificial intelligence and understanding. We used to use the word parsimony, and I think there's real tension now between parsimony and complexity and how we analyze things and where we fall out on that divide. The last C I have is for collegiality, which I think is what Chuck was all about, which is stay close to your principles, but always treat people with respect, and be courteous.